All right, welcome back to the deep dive.
Yeah.
So today we're going to be talking all about the Canadian Triage and Acuity Scale (CTS), and we're going to be looking specifically at how paramedics use it in the field.
That sounds great.
Yeah, yeah. So this will be really good for, anybody in healthcare,
Hmm.
anybody who's maybe going to school for some sort of medical, a career,
Hmm.
or maybe even just people who are interested
Absolutely.
in how these things work.
It's a fascinating topic.
Yeah, definitely so. So yeah, we're looking at the CTS paramedic guide, which is really cool. And yeah, I guess kind of the first thing that stood out to me was this idea of like two scores.
Right.
The arrival CPS and the departure CTS.
Yeah, it's not a statting assessment. It's a dynamic assessment and recognition that, the patient's condition can change pretty rapidly.
Right.
Especially with treatment.
Especially with treatment. Yeah. So, when a paramedic arrives on scene, that's kind of the first assessment, and that's what that arrival CTS is. But then, things might change. You might administer some treatment, and then there's a departure CTS.
Right. And that departure CTS is the one that's actually communicated to the hospital
Okay.
to prepare them for the patient's arrival.
Okay, that makes sense.
Yeah.
So like I was kind of thinking, does that also play into how hospitals, triage patients when they arrive?
Oh, for sure. I mean, having that heads up
Yeah.
on a patient whose condition is changing rapidly, whether it's for the better or for the worse, I mean, that's definitely going to factor into how they allocate resources.
Yeah. Yeah, because if somebody arrives and they're stable, but, the paramedics are saying, well, we gave them this treatment and it really stabilized them, but we're not really sure how long that's going to last.
Yeah, their condition could deteriorate again pretty quickly.
Right.
So they definitely want to be prepared for that.
Yeah. So it's just really fascinating to think about how all these things are kind of intertwined.
Yeah.
Yeah. Yeah. And so then, we have these CTS levels, and there's 5 of them. Level 1 being the most critical,
Correct.
and level 5 being the least critical. But I was curious, like beyond just kind of memorizing, okay, this is level 1, this is level 2.
Mm-hmm.
Like, how do paramedics in the field really kind of move beyond that to actually apply these things?
Well, I think the key is understanding the logic
Okay.
behind each level.
Okay.
So, it's not just about memorizing the number.
Right.
It's about understanding the specific symptoms, the vital signs, even the patient's medical history that all factor into the decision.
Right.
So it really is like putting together a puzzle.
Yeah.
You're looking for those telltale signs, those clues that give you the bigger picture of what's going on with the patient.
Yeah. And the guide goes into some pretty specific, rules and examples that I thought were really fascinating. So like, rule number 3 talks about how, like, even if treatment is effective,
Oh, right.
the departure CTS can't be drastically lower
Yeah.
than the arrival CTS. And at first I was kind of like, well, why is that? If the treatment worked.
Well, I think that really speaks to the importance of building in a safety margin.
Right.
You have to remember that things can change very quickly in emergency medicine. So even if a patient seems to be doing much better after treatment, there's always a chance of relapse or complications.
Okay. Yeah, that makes sense.
So the departure CTS needs to reflect that potential for change.
Yeah. So like an example of that would be like, say somebody's having a really bad allergic reaction.
Right. A severe allergic reaction or anaphylaxis.
And that's obviously going to be like a level 1
Absolutely.
because they could be, struggling to breathe.
Right.
Their airway could be closing up and that kind of thing.
Exactly. You're looking at airway, breathing, circulation. Those are your ABCs.
Right.
And if any of those are compromised, then you're automatically in a very high acuity situation.
Right. So then let's say the paramedics get there and they administer epinephrine.
Right. Epinephrine can be very effective.
Yeah. And that's like, the miracle drug for allergic reactions.
Absolutely. It can be life-saving.
Yeah. So they give them the epinephrine and the patient is like, oh, I feel so much better.
Right. But that doesn't mean they're out of the woods.
Right.
Anaphylaxis can be very unpredictable.
Okay.
And there's always a chance that their condition could worsen again. So even though they might seem stable at the time of departure.
The paramedics are still kind of like erring on the side of caution.
Exactly. They're thinking ahead. They're anticipating potential problems. And that departure CTAS is a way of communicating that to the hospital.
Okay, that makes sense.
Ah.
Yeah, so another rule that kind of stood out to me was rule number 4. And this deals with a pretty intense scenario, which is, a patient arrives and they have no vital signs.
Okay.
But then through, amazing work by the paramedics,
Right.
they resuscitate the patient.
They bring them back.
They bring them back. So in that case, the CTIS stays a level 1.
Yes, throughout transport.
Throughout transport. And I was kind of thinking, well, why is that? Because if you've resuscitated the patient,
Right. It seems like they should be stable.
yeah, wouldn't that mean that they're essentially, back to normal?
Well, not necessarily.
Sure.
You have to remember that cardiac arrest is a very serious event.
Right.
And even if a patient is successfully resuscitated, the risk of another cardiac event is still very high.
Okay.
So that CTS level 1 stays in place because the hospital needs to be prepared to provide immediate specialized care.
Oh, okay.
They need to be ready for anything.
So it's not just about, getting the patient's heart beating again.
Right.
It's about recognizing that they're still in a very critical state.
Exactly. Resuscitation is really just the beginning of what could be a long and complex medical journey.
Oh, wow.
And that CTS level 1 ensures that the patient receives the appropriate level of care every step of the way.
Yeah, that makes a lot of sense.
It's really about recognizing that even though you've brought them back,
Right.
they're still in a very precarious situation.
Wow. Yeah, that's really powerful.
And the hospital needs to be prepared for that.
Yeah, it really underscores just how critical these decisions are
Oh, absolutely.
the paramedics are making in the field. It's not just about, stabilizing a patient.
Right.
It's about setting them up for the best possible outcome.
Exactly. And thinking several steps ahead.
Yeah.
Anticipating potential problems and making sure that the hospital's ready to handle whatever comes next.
Yeah. Wow. So the CTS system even, provides guidance for some situations that are, sensitive, to say the least.
Right.
And the guide kind of touches on this, which is like, what happens in cases where a patient is obviously dead on arrival,
Right.
or if there's a termination of resuscitation order or a TOR order.
These are very challenging situations.
Yeah.
For everyone involved, paramedics, families, the whole healthcare team.
Mm-hmm.
And having clear protocols in place is absolutely essential.
Yeah.
It's not just about providing consistent care.
Right.
It's also about ensuring transparency and accountability. So the CTS system actually plays a very important role here by providing a framework for documentation and communication.
So even in those really difficult moments,
Yes.
There's still a system in place
There is.
to guide decisions and actions.
Absolutely. And that can be incredibly valuable for paramedics who are dealing with the emotional weight of these situations.
Right.
They need to know that they're following established protocols, that they're doing everything they can, and that their actions are being documented appropriately.
That makes sense.
Yeah.
Yeah. So, it's one thing to, assign a CTS level based on a patient's condition, but then that also kind of plays into where they're transported.
Oh, absolutely.
Right. So I'm assuming it's not as simple as just like, oh, the closest hospital.
Right. It's not just about speed.
Right.
It's about getting the patient to the right place for their needs.
Okay.
So while a level 1 patient, the most critical, will typically be transported to the nearest appropriate facility, the decision-making process becomes more complex with lower CTS levels.
Oh, so like what other kinds of things are paramedics thinking about when they're making those transport decisions?
Well, they're looking at the capabilities of different hospitals.
Yeah.
Some hospitals might be better equipped to handle certain conditions or trauma cases.
Right.
They also have to consider patient wishes, if known,
Okay.
and even local bypass protocols.
Bypass protocols, what are those?
Those are essentially pre-established agreements that direct certain types of patients, like stroke or heart attack patients,
Okay.
to specific hospitals that have specialized resources for those conditions.
But even though, a patient might be closer to a general hospital,
Right.
if they're having a stroke, they might bypass that hospital
Exactly.
and go to a hospital that specializes in stroke care.
Precisely. Even if it's further away.
Oh, wow.
Because in those cases, time is of the essence.
Right.
And getting the patient to the right facility
Right.
can make all the difference.
So it's really like a balancing act
It is.
between, proximity and specialized care.
Absolutely. And then you layer on things like patient wishes and local protocols,
Right.
and it becomes quite a complex decision-making process.
Yeah. Wow. It's really fascinating to kind of get a glimpse into all of that.
Yeah, it's amazing how much goes into those transport decisions.
Yeah. So here's another thing that I thought was interesting. The CTS score that's assigned by paramedics in the field
Yes,
might not always match the CTS score that's assigned by the hospital.
that's right.
And I was kind of like, well, why is that? Because wouldn't they be looking at the same information?
Well, they are, but remember, paramedics are making a dynamic assessment.
Okay.
They're seeing how the patient's condition changes from the moment they arrive on scene.
Right.
The ER, on the other hand, is using CTS as a triage tool at a specific moment in time
Right.
when the patient arrives at the hospital.
So it's kind of like two different snapshots of
Yeah.
the patient's condition.
2 points in time.
Yeah. Taken at different points in their journey.
Exactly. And both assessments have value. The paramedics' CTS helps them make decisions in the field and prepare the hospital,
Right.
while the ER CTS helps them prioritize patients and allocate resources within their own setting.
So it's not necessarily a problem that they might be different?
Not at all. It's more about understanding that each assessment serves a different purpose
Okay.
and that both are important for ensuring that the patient receives the best possible care.
Yeah, so it's really kind of amazing to see how this CTS system really helps kind of coordinate everything.
It does. It really does. It helps bridge the gap between pre-hospital and hospital care.
Yeah, it's really cool. So what stands out to you as like the most fascinating aspect of this whole system?
I think it's the fact that CTS manages to blend objective criteria with human judgment.
Okay.
So you have these specific rules and guidelines, but there's still room for paramedics to use their experience and intuition
Right.
to make the best call for each individual patient.
Yeah, so it's not just like a rigid algorithm.
No, not at all. It's a tool that supports clinical decision making.
Right.
It doesn't replace it.
Oh, that's really cool.
Yeah.
Yeah, it's a good reminder that even with, all the advances in technology and all the protocols we have,
Right.
it still comes down to, people.
People making decisions.
Yeah, making those tough decisions in really difficult circumstances.
Yeah. That human element is what makes this whole field so fascinating.
Yeah, it really is. It's been a really eye-opening deep dive for sure.
Absolutely.
I feel like I've learned so much about, what paramedics go through.
Yeah, it's a tough job.
Yeah, and I think a lot of people, they just kind of assume, oh, it's, you just drive fast and turn on the sirens.
Right, right. They don't see the whole picture.
Yeah,
They don't see the assessment, the treatment, the decision-making that goes on behind the scenes.
it's so much more than that.
It really is. It's
Yeah.
about bringing the emergency room to the patient.
Yeah.
It's about stabilizing them, managing their condition, providing life-saving care, all in a very short amount of time.
Yeah, and the CTS system is kind of like their guide through all of that.
It's a framework that helps them prioritize needs,
Right.
streamline communication, and make sure that the patient is getting the best possible care.
Yeah, it's amazing how much impact something as simple as like a numerical scale can have.
Yeah, it really is. It's a testament to the power of standardization and clear communication.
Yeah, before we wrap up, I wanted to kind of go back to something we talked about earlier about how CTAS isn't just about speed.
Right.
It's about getting the patient to the right place.
Exactly to the right place for their needs.
Yeah, and that's a really important point because it speaks to just how much thought goes into those transport decisions.
Absolutely. Paramedics aren't just thinking about the closest hospital.
Right.
They're considering specialized resources, patient wishes, local bypass protocols. All of these factors play a role.
Yeah, so it's like they're solving this, multi-dimensional puzzle.
They are. They really are. And the stakes are incredibly high.
Yeah. So what do you think is the biggest takeaway for our listeners?
Well, I think the biggest takeaway is that CTS is a great example of how even small innovations
Yeah.
can have a huge impact on a system.
Okay.
By giving paramedics a structured way to assess and communicate patient needs.
Right.
CTS has improved coordination between pre-hospital and hospital care.
Yeah.
It's streamlined resource allocation, and ultimately, it's saved lives.
It's incredible.
It really is. It's a testament to the power of collaboration
Yeah.
and the constant drive to find better ways to deliver care.
Yeah, and I think it's also a good reminder that we're all part of this system.
We are, whether we're healthcare providers, patients, or just concerned citizens.
Yeah.
Understanding how these systems work helps us appreciate the complexity of emergency medicine
Right.
and advocate for continued improvement.
That's a great point. All right. Well, this has been another fascinating deep dive.
It has.
Thanks for joining us.
My pleasure.
And to all our listeners out there, stay curious, keep learning,
Yeah.
and remember that every call, every decision, every interaction has the potential to make a real difference in someone's life.
Yeah, it really does highlight that, human element of it all, right? Like, it's not just about the numbers.
Yeah, you can have all the algorithms and the technology in the world,
Right.
but at the end of the day, it's still people
Yeah.
making those tough calls.
Making those judgment calls in the field. Yeah.
Exactly.
That's really cool. Well, this has been a super fascinating deep dive.
It has been, yeah.
I feel like I learned a ton about the CTS system.
Me too. It's a really fascinating system.
Yeah, and I think it's, for our listeners out there, it's a good reminder that emergency medicine is so much more than what you see on TV.
Oh, absolutely.
That it's so much more complex.
You have a very, very complex system with a lot of moving parts. And
Yeah.
CPS is just one piece of that puzzle.
But it's a very important piece.
Yeah, it really is.
Yeah.
Yeah, so as we wrap up here, what would you say is like the biggest takeaway?
I think the biggest takeaway is that CTS is a really great example of how even small innovations can have a huge ripple effect.
Okay.
By giving paramedics this structured way to assess and communicate patient needs.
Right.
CTS has really helped improve the whole system.
Okay.
It's improved coordination between, EMS and the hospitals.
Right.
It's helped streamline resource allocation, and ultimately, it's helped save lives.
Wow.
So it's a really powerful example of how we can constantly strive to improve emergency care.
Yeah, and it really is a testament to that, collaboration between, all these different players in the system.
Oh, absolutely.
You have the paramedics, you have the hospitals, you have the dispatchers, everybody's working together.
Yeah, it's a team effort.
Yeah, and CTS kind of helps, keep everybody on the same page.
It does. It provides that common language, that
Yeah.
shared understanding that's so essential in emergency medicine.
Yeah, well, that's awesome. Well, hey, thanks again for joining us for this deep dive.
It's been my pleasure.
And to all our listeners out there, stay curious, keep learning, and we'll catch you next time. Okay, so picture this. You're in a situation, and every second matters. Someone's fallen, they're hurt, and you need help fast. How do you tell the 911 operator just how urgent it is?
Right.
And then how do the paramedics, when they get there, how do they know how bad it is?
Yeah.
That's what we're diving into today.
Exactly.
The Canadian Triage and Acuity Scale,
Yeah.
also known as CTACE,
Mhm.
and this is the system that paramedics in Canada use
Right.
to figure out which patients need to be seen first
Yep.
and how to talk to the hospital,
Exactly.
even when they have to make decisions really quickly.
People think about triage and they think, oh, that's something that happens in a busy ER.
Right.
But we actually all do it every day.
Oh, yeah, for sure.
You prioritize your to-do list.
Absolutely.
You decide what needs to be done right now and wait.
Totally.
But when paramedics are using CTS,
Yeah.
the stakes are way higher.
Okay.
We're talking about decisions that could save lives.
That's a great point. It really puts it in perspective.
Right.
So how does CTS actually work?
Yeah.
Is it like this big checklist for paramedics?
It's more than just a checklist.
Right.
Paramedics are trained to use what's called the Canadian Emergency Department Information System,
Okay.
or CDs.
CD's got it.
Think of it like that universal translator from Star Trek.
Uh-huh.
It's this common language
Okay.
that has 18 categories for describing what's wrong with the patient.
18 categories.
18 categories.
So that covers everything
Yeah,
from like a sprained ankle to a heart attack.
absolutely.
Wow.
So it makes sure that everyone from the paramedics who are right there with the patient
Right.
to the staff at the hospital
Mhm.
are all understanding the situation in the same way.
Oh, that's so smart.
And actually, they're working on revising the list of presenting complaints
Okay.
to make it even more useful for paramedics out in the field.
Got it.
They're streamlining it based on what paramedics are actually seeing and experiencing.
So it's a living document.
Exactly.
It's changing
Gotta be. Yeah.
as medicine changes.
Exactly.
That makes a lot of sense.
Yeah.
But let's get back to the actual CTS assessment.
Okay.
How do paramedics figure out what CTS level to give a patient?
So it's a 4-step process,
Okay.
and you can almost think of it like solving a puzzle.
Okay.
The first step is called the quick look.
Quick look.
So imagine you get to the scene
Yeah.
and you see right away that the patient is in really bad shape.
Mm-hmm.
Maybe they're not even breathing.
Oh, wait.
In that case, you know right away what the CTS level is going to be.
Oh, okay.
Most likely a level 1,
Okay.
which is the most critical.
Okay, so for those really critical cases where it's like life or death,
Right.
they don't waste any time.
Exactly.
They just go right into trying to save the person's life.
Absolutely.
What about situations that aren't that obvious right away?
That's where the other steps come in.
Okay.
So the second step is all about figuring out what the patient's main complaint is.
Okay.
And then you match that complaint to one of those CDs categories.
Right.
So is it a heart problem, a brain problem,
Yeah.
something else entirely?
Okay.
This gives the paramedics a starting point,
Okay.
a way to start understanding what's going on.
So it's like they're narrowing it down.
Exactly.
Yeah.
They're focusing in.
But I imagine there are a lot of other things that could affect the CTS level,
For sure.
even within the same category.
Absolutely.
Right.
That's where steps 3 and 4 come
Okay.
in the modifiers.
Modifiers.
These are so important
Okay.
for figuring out exactly how serious the situation is
Okay.
and making sure they're giving the patient the right level of care.
Got it.
So let's say you have a patient with belly pain,
Abdominal pain.
abdominal pain, yeah.
Okay.
The first order modifiers look at things like their vital signs and their pain level.
So like their heart rate, their blood pressure.
Blood pressure, yeah.
how much pain they're in.
Exactly. Are they tachycardic?
Okay.
Is their blood pressure really low?
Hmm.
Is the pain so bad that they can't even talk?
It sounds like every little detail is important here.
It really
Yeah.
is. And then you have the second order modifiers.
Okay.
These go even deeper.
Okay.
So are there signs of internal bleeding?
Oh, wow.
Do they have a fever?
Mm-hmm.
Are there other symptoms that make the whole picture more complicated?
So they're gathering all this information,
Yeah.
putting it all together
Yeah.
to figure out the most accurate CTA level.
Exactly.
Okay.
You have to look at all the pieces of the puzzle.
Yeah.
And the CTA's Paramedic Guide version 2.0 actually gives a really good example of how these modifiers work in a real situation.
Oh,
Yeah.
tell me more.
They use this example of a patient with abdominal pain, and it shows how something that seems small, like whether or not they have a fever
Mhm.
or what their exact vital signs are,
Yeah.
can actually change what CTS level they get.
I bet that's really helpful for paramedics.
Yeah, especially the ones who are newer to the job.
Yeah.
It's like having a guidebook for making these tough decisions.
Exactly.
And speaking of guidance,
Yeah.
there's another tool that paramedics use that I think you'll find interesting.
Okay, what's that?
A flowchart.
Oh, flowcharts.
Yeah.
I love a good flowchart.
They can be super helpful.
So helpful.
Yeah, for understanding a complicated process.
Yes.
So this particular flowchart basically lays out the whole decision-making process
Okay.
step by step.
Nice.
So it starts with that initial quick look,
Right.
and then it branches out based on what's wrong with the patient,
Okay.
all those modifiers that we were talking about.
So it's like a map for paramedics
Yeah.
to help them figure out how to use CTS.
Yeah.
And make sure they're thinking about everything they need to be thinking about.
Precisely.
Cool.
It helps them figure out the most accurate CTS level,
Yeah.
which then tells them how quickly the patient needs to be seen
Hmm.
and what level of care they need.
It's amazing to see how this system combines medical knowledge with critical thinking
Yeah.
and communication.
Yeah, it's really cool.
Yeah, we've talked about CTs as this like common language,
Mm-hmm.
but this whole CTS system feels like it's another way of communicating to
Right.
make sure everyone understands how urgent the situation is
Right.
and what the patient needs.
Exactly.
Yeah.
It's about making sure that the patient gets the right care
Yeah,
at the right time
right.
with no hiccups along the way.
And it's all happening right there
Yeah.
in real time
In real time.
with lives on the line.
Absolutely.
It really makes you appreciate just how skilled and knowledgeable paramedics are.
It really does.
They have to be on top of their game.
It's amazing what they do.
Yeah.
Yeah. It really is a remarkable system.
Mm-hmm.
And it's all about making sure that you, the patient, are getting the best care possible
Okay.
at the right time.
So let's talk about those CTS levels.
Okay.
How many are there?
So there are 5.
5. Okay.
And each one tells you how urgent the situation is.
Okay.
So CTS level 1, that's
One.
the most critical.
Okay.
That's for people who need immediate life-saving care.
Got it.
Like, you know those scenes you see on TV where someone's being rushed into the ER?
Yeah. Yeah.
That's a CTS level 1 situation.
Okay. Life hanging by a thread.
Exactly.
Every second counts.
Yep.
What about level 2?
Level 2 is still really urgent.
Okay.
The patient needs to be seen and treated quickly,
Mhm.
but it might not be quite as immediately life-threatening as level 1.
Okay.
You know, they might have a little bit more time to get the patient stable
Right.
before they need more serious care.
So still serious.
Oh, yeah.
But maybe a few more minutes to work with. And then the other levels, I'm guessing they just kind of go down in urgency from there.
You got it.
Okay.
CTS level 3, those are urgent cases.
Okay.
The patient needs to go to the ER,
Mm.
but there's a bit more flexibility in terms of time.
Okay.
Then you have CTS level 4, which is less urgent.
Mhm.
And finally, CTS level 5, that's for non-urgent situations.
So it's like a scale of urgency.
Yeah,
Kind of a volume knob on a stereo.
I like that.
Level 1 is blasting.
Exactly.
Level 5 is like a whisper.
Perfect analogy.
Okay.
And here's something important that the CTS Paramedic Guide really emphasizes.
Okay.
Even if a paramedic finds a modifier that points to a certain CTS level,
Yeah.
they don't just stop there.
Oh.
They keep looking.
Really?
They're trained to keep digging.
So even if they find one thing that suggests a specific level,
Yeah.
they don't just assume that's it.
Nope.
They keep investigating.
They keep going.
They're
They
brave.
want to make absolutely sure they haven't missed anything. That could change the CTS level.
That's impressive.
Yeah. It's a great example of how much detail and critical thinking goes into pre-hospital care.
It really shows how important it is to be thorough. They're
Absolutely.
doing all these assessments
Yeah.
while they're also like managing the whole scene,
Right.
talking to the hospital,
Yeah.
taking care of the patient.
Exactly.
It's a lot.
It's amazing what they can do.
It really is.
That's why the system is so important.
Yeah.
It gives them a framework for making fast decisions, even when everything's crazy
Right.
in an emergency situation.
What I find really interesting is how much emphasis there is on communication.
Oh, yeah, for sure.
We've talked about CDs as this common language.
Yeah,
But this whole CTS system feels like another layer of communication.
absolutely.
It's like a way to make sure everyone knows how urgent it is
Right.
and what the patient needs.
Exactly. It's like a relay race. You're passing the baton from the paramedics to the hospital, and you want to make sure that handoff is smooth.
Seamless.
Seamless, exactly.
Wow. And this is all happening
Yeah.
like in real time
Yeah, in the
with lives potentially at stake.
Absolutely.
It really makes you appreciate the skills and the knowledge
Oh, yeah.
that paramedics bring to every situation.
You really have to hand it to them.
They have to be so sharp,
Mm.
so observant,
Yeah,
and able to think on their feet.
for sure.
It's amazing.
It really is.
Thinking about those challenges that
Yeah.
paramedics face out in the field, the guide mentions some interesting specifics
Oh, yeah.
about certain presenting complaints.
Okay.
For instance, it talks about how seizures can be really tough to assess
Oh, yeah. Seizures.
Yeah.
They can be tricky.
because they can look like so many different things.
Right. And the reason someone's having a seizure can be totally different from person to person.
Right.
You know, a seizure could be a sign of something minor, or it could be something really serious going on with their brain.
Wow.
So paramedics have to be really good at spotting those little signs and symptoms
Yeah.
that could mean something more serious is happening.
So it's not just about recognizing that someone's having a seizure.
Right.
It's about figuring out what that seizure is telling them
Exactly.
about the patient's overall health.
Like they're putting together a puzzle, they're looking for clues.
Asking the right questions.
Yeah, all to figure out what the best thing to do is.
And they're doing all
That's
this
incredible.
while they're also taking care of the patient
Right.
and making sure they're safe.
It's a lot to juggle.
It is.
And that's just one example.
Right.
The guide also talks about how complicated it can be to assess mental health emergencies,
Oh, yeah.
which can be just as challenging
Mhm.
and require a whole different approach.
Because mental health crises can present in so many ways.
Absolutely.
And you really need to handle those situations carefully.
Yeah.
And with a lot of understanding.
For sure.
Yeah, it makes you realize that there's a lot more to being a paramedic
Oh, yeah.
than just driving an ambulance
For sure.
and knowing how to use the equipment.
It's about thinking critically,
Mhm.
solving problems,
Yeah,
understanding how the body works
right.
and how the mind works.
And that brings us back to CTS.
Yeah,
This system that seems pretty simple when you first hear about it.
right.
But it's actually super nuanced and complex.
Yeah, it's like an iceberg.
Oh, I like that.
You only see the tip,
Yeah.
but underneath there's this whole huge structure.
And the CTSS Paramedic Guide version 2.0
Mm-hmm.
really helps us understand all of that.
Totally.
It's more than just a guidebook.
Yeah.
It shows how emergency medicine is always changing
Mm-hmm.
and how dedicated the people who work in this field are.
What I find really interesting is that they've made this incredibly detailed system,
Yeah.
but they're still working on it,
Yeah.
trying to make it even better.
Yeah.
Like, the fact that they're updating that list of presenting complaints
Right.
shows you how committed they are to providing the best care possible.
It's like they're never satisfied.
Exactly.
They always want to improve,
Yeah,
even when they already have a system that's saving lives.
for sure.
So, for our listeners out there,
Yeah.
what's the one thing you want them to remember about CT?
I think the most important thing to remember is that CTAS isn't just about paramedics and hospitals.
Okay.
It's about you.
Oh, wait.
It's about making sure that you, the patient,
Mm-hmm.
get the right care at the right time,
Right.
no matter what's going on.
Clear.
So the next time you see an ambulance racing by,
Yep.
remember that CTAS is working behind the scenes,
Mm.
helping those paramedics make those split-second decisions
Yeah.
that could make all the difference.
It's pretty reassuring to know that it's a system that's always being checked and improved.
Absolutely.
Makes you wonder what other new and exciting things are coming up. Yeah. In the world of pre-hospital care.
What new technologies,
Yeah.
new ways of doing things?
What's next?
Yeah, what's next?
Well, that's a great question to think about
Mm-hmm.
as we wrap up our deep dive into CTS and pre-hospital triage.
Yeah.
We hope you learned something new
Yeah.
and maybe even got a little bit curious about the amazing work that paramedics do every day.
Absolutely.
We'll see you on our next deep dive. Ever wonder how paramedics decide who gets help first in an emergency?
Oh, yeah, for sure.
You know, when they get to a scene and there's multiple people who need help?
Right, right. Yeah.
Well, today we're going deep on how they do that.
Okay.
It's all about a system called the Canadian Triage and Acuity Scale,
Okay.
CTS for short.
CTS, got it.
And basically, paramedics use this to quickly figure out how serious someone's medical situation is,
Okay.
and then how urgently they need care.
Right.
We're using the CTS Paramedic Guide as our main source today,
Mm-hmm.
and it's really interesting. It kind of lays it all out.
Yeah.
So think of it this way. CTS is all about making sure that in a medical emergency,
Mm-hmm.
the most critical cases get seen like the fastest,
Yeah.
like the quickest response.
Makes sense.
Because obviously resources are limited.
Right.
And, when there's a major accident or something,
Yeah.
you need to know who to help first.
Absolutely.
So CTS helps save lives ultimately by, making sure resources are used wisely.
I see, yeah.
But here's a question for you.
Okay.
If you see someone who's unconscious,
Uh-huh.
would they automatically be a CTS level 1?
Oh, that's a good question.
Because that's like the most critical level.
Right, yeah, the most serious.
The answer is actually not that simple.
Oh, really?
So let's get our expert to kind of break down all the levels and how it all works.
Sure. So I think one of the things that makes CTX so interesting is it goes beyond,
Wow.
like just a quick look at the patient. It actually digs deeper to assess the real threats to the patient's life
Okay.
and what kind of help they need right away
Right.
to stabilize them.
So it's more in-depth than it might seem on the surface?
It is, yeah.
So how many levels are there?
There are 5 levels to the system.
Okay.
And you're right, level 1 is the most serious.
Okay.
That's called resuscitation.
Okay.
And these are the cases where literally every second counts.
Oh.
So we're talking heart attack, major trauma, difficulty breathing. Basically, if your airway, your breathing or your circulation is in immediate danger,
Uh-huh.
you're a level 1.
So those are like your ABCs, basically.
Exactly. Yeah, that's a good way to remember it.
Okay, so level 1 is like the get them to the hospital right now category.
Right.
What about level 2?
So level 2 is what we call emergent.
Emergent.
And these patients, they're seriously ill or injured,
Okay.
and they could get worse really fast.
Okay.
So, you got to think things like stroke,
Mhm.
a severe allergic reaction, uncontrolled bleeding.
Right.
They definitely need rapid treatment,
Right.
but they might not be, at that like actively dying stage,
Oh,
like
oh.
some level 1s.
So it's still like a lights and sirens situation.
Oh, absolutely.
But
Okay.
maybe there's a little bit more time to stabilize them on scene.
Yeah, exactly. You might need to do some interventions on scene before you go.
Okay.
And then we have level 3, which is urgent.
Okay.
Urgent. And these patients are the ones who could have, serious problems later on.
Right.
But right now, their vital signs are stable.
Okay, so they seem okay in the moment,
Yeah, they seem okay for the moment.
but it could be something more serious.
Right, they might be in a lot of pain.
Oh, okay.
Think like kidney stones.
Oh, yeah.
Or have a condition that needs attention,
Mm-hmm.
but isn't immediately life-threatening.
Okay.
So not life-threatening right this second.
I bet that's tough for the patient, though.
Yeah, I can imagine.
Like, you're in agony, but you're breathing and your pulse and everything's fine.
Right.
So it's like, how do they decide then?
That's where the paramedics' judgment really comes in.
Yeah.
They have to use their training and their experience to assess the situation.
To figure out the right level.
Exactly.
Okay, so we've got level 1, resuscitation, level 2, emergent, level 3, urgent.
Right.
What's next?
So moving down the scale, we have level 4,
Okay.
which is less urgent.
Less urgent, all right.
And this category includes conditions that are less acute.
Okay.
Their vital signs are stable,
Okay.
pain's manageable.
So, like, what kind of things are we talking about here?
So think like a minor fracture,
Right.
maybe a flare-up of a chronic condition.
Right, so they still need to be seen.
They absolutely need medical attention.
But maybe not like lights and sirens rushing to the ER.
Right, exactly.
That's-
And then lastly, we have level 5,
Right, the last one.
which is non-urgent.
Not urgent. Okay.
And as the name suggests, these are for minor complaints that don't pose an immediate threat.
Okay.
So think a sprained ankle,
Uh-huh.
a small cut that needs stitches.
Right. So paramedics need a way to, like, tell the difference between those kinds of things.
Absolutely.
Between a stub toe and a heart attack.
Exactly. And that's really the beauty of CTS.
Uh-huh.
It helps ensure that the right resources
Okay.
are available for the right patients at the right time.
Makes a lot of sense.
It's also worth mentioning that CTS does use color codes in the emergency department.
Oh, really?
Yeah, to kind of visually show the urgency. But it's important to know that those colors are different from the ones used for triage
Okay.
in mass casualty incidents.
Yeah, that would be really bad if they got mixed up.
Oh, absolutely. Yeah, that would be a big problem.
So we've got these 5 levels,
Mm-hmm.
but how do paramedics actually use this system when they're out in the field.
Right. So here's where it gets even more interesting.
Okay.
Unlike in the emergency room where, CTOWS is assigned just once when the patient arrives,
Right.
paramedics actually assign 2 CTS levels.
Oh, 2 different levels.
Yeah. So there's the arrival CTS when they first assess the patient,
Okay.
and then there's the departure CTS right before they leave the scene.
Hold on. So a patient's CTS level can actually change
Yes, exactly.
depending on what the paramedics discover or how they treat the patient.
Absolutely. It reflects just how dynamic pre-hospital care is.
So, wow.
The initial assessment that they do,
Yeah.
it can evolve as paramedics gather more information. Maybe they provide some treatment or just observe changes in the patient's condition.
Right. So it's not like a one and done assessment. It's
Right.
constantly evolving.
Constantly changing.
Yeah. Wow. And is that it or is there more?
Well, get this.
Okay.
There can even be more CTS updates en route to the hospital,
Oh, wow.
especially on longer trips.
So it can change like even after they leave the scene.
Exactly.
Wow.
So if a patient's condition changes significantly,
Mm-hmm.
paramedics reassess and they update the CTS level.
Oh, wow.
And this helps the hospital staff know exactly what they're dealing with.
Okay.
And they can prepare the right resources.
Oh, that makes a lot of sense.
Yeah, so they're ready when the ambulance arrives.
Wow. I never knew that.
Yeah, it's pretty cool.
It sounds like there's a lot of flexibility built into this system.
There is.
But how do paramedics ensure they're assigning the correct CTS level?
Right.
Like, especially when things are changing so quickly.
Yeah, that's a really important question.
Are there rules?
There are rules, and these rules are really crucial for accuracy
Okay.
and, most importantly, patient safety.
Right.
So there are 6 main rules.
6 main rules.
Yeah, and each one serves a specific purpose.
Okay, well, let's unpack them.
Okay.
What's the first one?
All right, so rule number 1,
Okay.
it essentially just reiterates what we just talked about.
Okay.
Every patient gets at least 2 CTS scores.
Okay.
The arrival CTS and the departure CTS.
Right.
It's all about, tracking their condition over time
Okay.
and creating an accurate record.
Makes sense.
So rule number 2.
Okay, rule number 2.
It clarifies which CTS level the receiving hospital gets.
Okay.
And that is the departure CTS
Okay.
or the most recent update.
Right.
If the patient's condition changed during transport.
So even if the patient gets better or worse
Right.
on the way to the hospital,
Yeah.
the hospital knows like exactly what to expect.
Exactly. It's all about communication.
Okay.
And then rule number 3.
Go ahead.
This one's interesting.
Okay, I'm ready.
It's like a safety net.
Right.
So rule number 3 says that even if a patient dramatically improves after treatment, their departure CTS can't be more than 2 levels lower than their initial arrival CTs.
So even if someone seems way better after getting medication or, whatever intervention the paramedics do, the paramedics can't just be like, oh, they're fine now and downgrade them too much.
Yeah, exactly. You got it.
Okay.
Remember, a patient's condition can change so quickly.
Right, especially out in the field.
Exactly. So this rule is there to make sure that a patient who was initially serious
Okay.
still gets taken to a hospital that can handle potential complications.
So it's like a safeguard
Yeah,
to avoid those situations where you think someone's stable, but then they suddenly take a turn for the worse.
exactly. It's
Yeah.
all about being cautious.
Right.
Okay, so moving on to rule number 4. This one deals with a very specific situation.
Okay.
Patients who are resuscitated from cardiac arrest.
So if someone's heart stops and the paramedics bring them back, what happens to their CTS level?
So even if they regain consciousness and seem to be recovering,
Okay.
their CTS stays at level 1.
Wow. So even though they're like back,
Yeah.
they're still considered a level 1?
Yes.
Why is that?
Well, because anyone who's had a cardiac arrest is at a very high risk of it happening again.
Oh, okay. That makes sense.
So keeping them at level 1 ensures that they go to a hospital that's ready to handle another cardiac event.
So it's not about how they're doing like right then.
Right.
It's about like what could potentially happen.
Exactly. It's all about planning for those potential complications
Yeah, that makes sense.
and making sure they get the most appropriate care.
All right. So rule number 5.
This one tackles a kind of sensitive topic.
Okay.
Termination of resuscitation,
Oh, wow.
or TR.
TR. Okay.
So this is obviously a difficult situation.
Yeah, I can imagine.
But sometimes, despite paramedics' best efforts, resuscitation attempts are just not working.
Right.
So in these cases, the CTS depends on what the patient's condition was when paramedics arrived.
Okay.
So if they were already deceased or obviously dead as it's defined in the basic life support patient care standards,
Okay.
they're documented as CTS level 0.
CTS level 0.
Yeah.
Okay.
So even in those sad cases, CTS has a role in accurately documenting what happened.
Right. So it's important to have that consistency, I guess.
Absolutely.
What if a patient isn't deceased when paramedics arrive,
Okay.
but then later they go into cardiac arrest and the two-air order is given?
Okay, so in those situations, if the patient was initially a CTS level 2 or lower.
Okay, so like maybe someone with chest pain or something,
Exactly.
but then they go into cardiac arrest,
Right.
their arrival CTS wouldn't change.
Exactly.
Right.
But if they're transported, the departure CTS would be level 1.
Level 1. Okay, so it reflects the change of their condition,
Right.
but it still like acknowledges what their initial severity was.
Yeah, exactly.
Okay, and what if a TAOR order is given before they even transport the patient?
So in that case, a departure CTS of 0 is documented,
Right.
whether or not they're transported.
All right, so 0 if they're deceased on arrival,
Yeah.
and then 0 if a TAOR order is given before transport.
Right.
Okay, got it.
So there's a lot of nuance,
Yeah, a lot to think about.
but the rules help ensure consistency and accuracy.
Right, and ultimately it's about, the best care for the patient.
Absolutely.
Okay, so we've covered rules 1 through 5.
Right.
What about rule number 6?
Okay, so Rule 6, this one's specifically for cases where the patient is obviously dead when paramedics arrive.
Obviously dead. Okay.
So it basically says that if they meet that criteria for obviously dead according to the BLS PCS,
Okay.
then no CTS level is assigned.
Okay.
And they're just documented as a 0 on the ambulance call report.
So kind of like what we were talking about with those 2R situations where they're already deceased on arrival.
Exactly, yeah. It's about keeping the documentation consistent
Okay, that makes sense.
across all those different situations.
So it seems like all these rules are really designed to make this system reliable
Yeah.
and like robust, so it can really handle all these different situations.
Absolutely. It's about making sure it works in the real world,
Right.
where things are often unpredictable.
But how does CTS affect where a patient's actually taken?
Oh, that's a great question.
Because, like, I imagine a level 1 trauma needs a different kind of hospital than a level 3 sprained ankle.
You're absolutely right.
So how does that work?
Well, the departure CHAS plays a key role in deciding the receiving facility.
Okay.
So for level 1 and 2 patients,
So the most urgent ones?
exactly, the most urgent cases,
Okay.
they're taken to the nearest appropriate facility.
So just get them to the closest place that can help them.
Right, exactly. Time is of the essence.
Okay, makes sense.
But for less urgent cases,
Okay.
like levels 3, 4, and 5,
Right.
the most available receiving facility is usually chosen.
So they try to spread the patients out a little bit
Yeah, exactly.
so that one hospital isn't overwhelmed.
Exactly. And it also allows for a bit more patient preference,
Oh.
for those less urgent cases.
So like if I have a sprained ankle and I prefer to go to a certain hospital,
Right.
they'll take that into consideration.
They'll try to accommodate that if it's feasible
Okay.
and it doesn't, compromise patient care.
So it's like finding that balance
Exactly.
between urgency and patient choice.
Yeah.
All right, that makes sense.
So it's a constantly evolving system,
Yeah.
trying to always improve and give patients the best possible care.
Okay, but where's all this CTS information documented?
Good question.
Like in the official records?
Yeah, you got to keep track of it all.
Right.
So paramedics document CTS levels on the ambulance call report,
Okay.
the ACR,
Yes, you got it.
and currently the ACR has a specific field for the departure CTS.
Okay.
And the arrival CTS is documented in the remarks section.
Okay, so it's all there.
But newer versions are going to have dedicated fields for both.
Oh, okay, even better.
Yeah, for both arrival and departure CTS.
Great.
And also for the CTS level when they reach the destination.
Wow. So they really thought of everything.
Yeah, they're always trying to improve the system.
So they have a whole history then
Uh-huh.
of how the patient's condition was assessed and how it changed.
Absolutely. It's all about having a complete record.
Okay, so we talked about how paramedics use CTS.
Mm-hmm.
But what about the people in the emergency department?
Yeah.
Do they always agree with what the paramedics decide?
That's a great question.
Like, do they see the patient come in and are like, wait a minute, this isn't a level 2.
Right?
This is a level 3 or whatever.
Yeah. And that actually highlights a really important point.
Okay.
The CTS level that a paramedic assigns might be different from
Okay.
what the ED assigns.
Really?
Yeah. And it's important to remember that pre-hospital CTS is dynamic.
Right, we talked about that.
It reflects the patient's condition over time.
Uh-huh.
But ED CTS is more like a snapshot
Okay.
based on how they look when they arrive at the hospital.
Right, so it's like two different perspectives on the same patient.
Exactly.
Right.
And remember, paramedics are working with limited information out in the field,
Right.
while ED staff have more resources and diagnostic tools.
Right, they could do blood work and all that stuff.
Exactly.
Okay.
So some discrepancy is expected.
Does that mean the system's not working?
Not at all.
Okay.
Studies actually show that CTS assignments are accurate within one level,
Okay.
85% of the time.
85%? That's pretty good.
Yeah, that's pretty impressive considering the challenging environments
Right.
that paramedics are often working in.
Yeah, absolutely.
So perfect agreement isn't really the goal here.
Okay.
It's about getting patients to the right level of care
Uh-huh.
as quickly and safely as possible.
That makes sense.
So it's about using the information you have
Right.
to make the best decision in the moment.
Okay, so we've talked a lot about how paramedics use CTS.
Yeah.
But let's go back to that initial question we had about unconscious patients. So, to put it simply, is an unconscious patient automatically a CTS level 1?
Well, not necessarily.
Okay.
It really depends.
Oh, no.
Well, unconsciousness can be caused by a lot of different things.
Uh-huh.
Some are obviously more serious than others.
Right.
I mean, think about it.
Okay.
Someone who faints because their blood sugar's low,
Mm-hmm.
they might lose consciousness for a bit,
Right.
but that's totally different from someone who's unconscious because of a head injury.
Right. Yeah, that makes sense.
So it's not just about whether they're unconscious.
Okay.
It's about why.
So the paramedics have to figure that out.
Exactly.
Yes.
They're trained to look at the whole picture.
Okay.
They consider the vital signs,
Uh-huh.
any visible injuries,
Okay.
what happened leading up to the situation.
So they're like detectives,
Kind of, yeah.
putting all the pieces together.
Exactly. And then they use all that information to determine the most accurate CTS level.
It's really impressive, like how much they have to consider in such a short amount of time.
Yeah, they don't have a lot of time to make these decisions.
And it's a lot of pressure
Oh, absolutely.
because, people's lives are at stake.
Right. Every second counts.
Well, I think we've covered a lot of ground today,
Yeah, we've gone pretty deep.
and hopefully our listeners have a better understanding now
Mm-hmm.
of how this whole CTS system works.
I hope so.
It's such a vital system
It is.
for connecting people with the right care at the right time,
Absolutely.
especially, when resources are limited,
Which they often are.
unfortunately.
Well, yeah, that's the reality.
But before we wrap up,
Okay.
I have a bit of a thought-provoking question for you.
All right, I'm ready.
So, if you were designing a triage system,
Okay.
what factors would you consider
Oh, wow.
beyond those that are already used in CTS?
That's a tough one.
And now it's something to think about
Yeah, definitely.
because the goal of any triage system
Uh-huh.
is to use those limited resources
Mm.
fairly and effectively.
Okay, everyone gets a chance
Exactly.
to get the care they need.
So yeah, let us know what you think.
Yeah, we'd love to hear from you.
We're always interested in hearing from our fellow deep divers.
Yeah, absolutely.
All right. Until next time,
See ya.
stay curious.
Welcome back for another deep dive. You guys know how much we love to go deep into the source material you send us, and today is no different. We're taking on something specifically requested, the Canadian Triage and Acuity Scale. CTS for short. This one is dense. But don't worry, that's what deep dives are for. We're going deep into that paramedic guide to figure out how this system plays out in those crucial first moments of an emergency.
It really is a fascinating system, and it goes way beyond just taking vital signs.
Oh, yeah.
It's about getting the whole picture of how the patient is doing
Yeah.
and predicting how fast they might need more care.
Predicting.
Yeah, like will their condition get worse and how soon?
So it's about looking ahead.
Exactly.
Okay, well, let's start at the beginning. CTS uses a 5-level scale, right? Kind of like, I don't know, maybe like a video game difficulty setting.
That's a great analogy.
Is it?
Yeah. Level 1 called resuscitation. That's for those critical final boss scenarios. Think cardiac arrest where the body just isn't working right and you have to do something immediately.
Oh, wow. So every second counts at level 1.
You got it.
What about level 2? How is that different?
So level 2 is emergent. It's not as immediately life-threatening as level 1, but still super serious and can change very quickly.
Got it.
These patients often need things done fast, and time is still a major factor.
I can imagine.
Think stroke or a big allergic reaction where what you do early on can totally change how things turn out.
So it's like a race against time to stop things from getting even worse.
Yeah, exactly.
This is already showing how important those paramedics are at the scene. What about level 3 then?
Level 3 is urgent. It still means something's wrong, but might not be an immediate threat to life. This is usually where we see patients with a lot of pain.
Pain.
Yeah, like if you break a bone or have a kidney stone.
Yeah.
Think of it as needing attention and help, but not as time-sensitive as those higher levels.
So they still need care, but it doesn't have to be lights and sirens to get them to the hospital.
Right.
Okay, what about those less urgent situations, those level 4 cases?
Level 4 is less urgent.
Okay.
It's for people who are generally stable but still need to be seen.
Like what?
They might have lower pain and okay vital signs.
Hmm.
Think of like a sprained ankle or a small cut. They need help but aren't in immediate danger.
Okay, so they need to be seen, but it can probably wait a bit.
Right.
And lastly, level 5.
Level 5 is non-urgent. These are for minor complaints that don't pose any immediate threat.
Like what?
Think a little cut that just needs a bandage or a case of the sniffles.
Mm-hmm.
They might need some basic care, but it's not a big deal if it waits.
So we've got our 5 levels, each with its own level of urgency and potential for things to get worse.
Right.
But I see this guide mentions arrival and departure, CTS.
Uh-huh.
That seems like something important we should look into.
It's super important. It helps keep track of how the patient's doing throughout the whole interaction with the paramedics.
Okay.
Arrival CTS captures what's going on with the patient right when the paramedics show up. It's like a snapshot of their condition before anything's been done.
So like a first impression to give a baseline before any action is taken.
Exactly. And that arrival CTS information isn't just for deciding what care to give right away.
No.
It's also used to look at response times and how efficient the whole system is working. It helps figure out ways to improve emergency care in general.
Oh, wow. I hadn't even thought about that.
Yeah. So then there's departure CTS. That one's done after the paramedics have given care at the scene and are about to transport the patient.
So departure CTS shows how the patient is doing after treatment. It's like a progress report.
Exactly. It helps determine the best place to take the patient. It considers things like how sick they are and what each hospital can handle.
So a level 1 or 2 with a departure CTS that's still high would go straight to the closest, most equipped place.
Exactly.
But what happens if things change during transport, especially if it's a longer trip?
That's where the cool thing about CCAS comes in. It can change.
Yeah.
Paramedics can reevaluate and give a new CTS level while they're transporting the patient if things get better or worse. They also tell the hospital about any changes so they're prepared.
Wow, it's so flexible. It's not just a one-time thing, but changes with the patient.
Exactly. That's really important to make sure they're getting the best care possible no matter what happens. But, this brings up something else. The guy talks about the human factor.
Okay, yeah, I definitely want to talk more about that.
Yeah.
We've been talking about these levels, but how do paramedics ensure they're being fair and consistent when they decide what level someone is?
Yeah.
It seems like there's a lot of room for interpretation.
It's a great point. And the guide talks a lot about avoiding judging people when you're assigning CTS levels, like not letting your own opinions get in the way. It says paramedics have to be neutral, and just look at the medical facts.
Right, because just how a patient looks or acts might not really tell you how sick they are.
Exactly. Yeah. And if you get that wrong, it can be really bad for the patient. So the guide stresses the importance of making sure assessments are always consistent and fair to minimize any risks.
So they look beyond just what they see and really focus on gathering all the information, vital signs, symptoms, the patient's history to get a true picture.
Exactly. That's how you use the CTS system correctly and effectively. So to see how this actually plays out in the real world, let's go back to that example you mentioned before about chest pain.
Okay, perfect.
Picture this. A middle-aged man clutching his chest, sweating like crazy, clearly in a lot of pain. What do you think goes through the paramedic's mind first?
Well, chest pain, that's a huge red flag.
Right.
I immediately think heart attack. They need to act fast.
Exactly. That's what they're thinking too. A possible heart attack, and that things could go downhill very quickly. It changes their whole approach to the situation right away.
So they're already thinking about those higher CTS levels just because of the type of call it is.
Absolutely. They immediately check his vital signs: heart rate, blood pressure, breathing, and oxygen levels. They'll also ask a lot of questions about the pain. When it started, how bad it is, if it's moving to other parts of his body.
So they're gathering as much information as they can as quickly as possible to make that first CTS call.
Yes. They need to get a clear picture of what's happening.
Mm-hmm.
They also look for other clues. Does he have a history of heart problems? Is he pale? All of these little things can help them figure out what to do.
Let's say his vitals are abnormal and he says the pain feels like something's crushing his chest and it's going down his left arm. Aren't those classic heart attack symptoms?
They are.
So then what?
In that case, the paramedic would probably give him a level 2 emergent CTS, and then they'll start treatment right away. Oxygen, aspirin, maybe, and get ready to take him to the hospital fast.
So the CTS level guides their actions and helps them decide what to do first.
Exactly. It makes sure that the people who need it most get immediate, focused care. But the interesting thing about CTAS is that it can change. What do you think might happen if, after that initial treatment, his pain goes down and his vitals get better?
Well, it sounds like things are improving, which is great, but would they look at his CTAS level again before they take him to the hospital?
For sure. The paramedic would look at him again, and seeing those improvements might change his CCAS level to a 3, urgent, before they leave.
Okay.
He still needs to go to the hospital, but it's not as critical as it first seemed.
That's so cool. It really shows how CTESS isn't just a one-time label. It's always changing with the patient's needs.
Exactly.
And that flexibility is so important to make sure the right care is given every step of the way. This already gives me a much better idea of how CTESS works in the field, but I'm excited to go deeper and learn more about the details of this system. Is there more we can dig into?
Absolutely. There's still a lot to uncover.
We've been talking about how CTESS helps paramedics make these decisions out in the field. But it's not just about checking off boxes, right?
No, not at all.
Paramedics have to use their knowledge and experience to put all those factors together to weigh the risks and make the best choices for each patient.
Exactly.
But I imagine that's got to be tough, especially under pressure, to find that balance between following those guidelines and trusting your gut.
Absolutely.
Yeah.
And that's why the guide emphasizes that being non-judgmental is so important. Approaching every patient with a fresh perspective, focusing on the medical facts, not assumptions.
Right. Because even if someone doesn't fit the typical picture of a heart attack patient, they could still be having one.
Exactly.
Yeah.
Missing those less obvious cases could be really bad.
Yeah.
So that consistent, unbiased approach is essential.
Okay, so that brings up a question. What if a paramedic comes across a patient who's clearly in distress, but doesn't quite meet the criteria for a higher CTS level? How do they handle that?
That's a great question. It shows how flexible the CT system is. It's a guide, not a rule book. Paramedics can use their judgment to adjust the level if they think it's necessary.
So, like, if they think something's off, even if the initial assessment doesn't quite fit.
Exactly. Especially if they see signs that things could get worse. They might move a patient to a higher level even if it doesn't perfectly fit the category.
That's good to know. It adds that human touch to a system that seems so focused on data. It's that mix of objective information and expert judgment that seems to make CTS so successful.
It's all about finding that balance.
Yeah.
Using the guidelines, but also trusting their training in those crucial moments.
Okay, so we talked about the 5 levels of urgency, avoiding bias, and that built-in flexibility. But let's go back to that chest pain example.
Okay.
What happens after they make that initial assessment and give a CTS level?
Well, once they've done everything they can to stabilize the patient on the scene, they have to decide where to take them.
So like we said, for that level 2, it's probably straight to the closest hospital with the right equipment for a cardiac emergency.
Exactly. Time is crucial in those situations. But for other CDS levels, they'll consider other things. What the patient needs, what different hospitals can handle, even things like traffic.
I can imagine that gets tricky, especially in a busy city with so many different hospitals.
Sure. It's another area where their judgment and decision-making skills are put to the test. They're always assessing the situation, figuring out the options, making the call for each patient.
So even though those guidelines are there, it's not as simple as just following a checklist.
Right. And it doesn't stop at getting the patient to the hospital.
Oh.
The paramedics also have to talk to the hospital staff, give them all the details to ensure a smooth handover. They're basically setting the stage for the next part of the patient's care.
Right. That communication is key. It's not just about driving fast, but making sure the hospital is ready.
It's a team effort. And CTS is like the glue that holds it all together, making sure the right care is given at the right time.
I'm really starting to understand the complexity of all of this, but I feel like we've only just scratched the surface of CTES. There's got to be more, right?
Definitely. We've covered a lot, but there are still some really interesting things to dive into.
Okay, so we've talked about a lot with CTES, the 5 levels, the importance of not being biased, and how the system adapts to changing situations. It's clear that CTES is vital for paramedics. It helps them make those big decisions in the first few minutes of an emergency.
It's a system designed to bring order to what could be a really chaotic situation.
Right.
It provides a framework for assessment and prioritization.
Yeah.
But like any system where humans are making judgment calls, there are nuances to consider.
Yeah, and that's what I want to explore a little more. You mentioned before the possibility of bias when assigning those CTS levels. The guide emphasizes how important it is for paramedics to approach every patient with a neutral and objective view, leaving any personal opinions or assumptions behind.
Exactly. It's recognizing that how a patient looks or acts might not tell the whole story.
Mhm.
Some people might downplay their symptoms or seem really tough, while others might be more expressive about their pain.
So it's about looking past those first impressions and really gathering all the information,
Right.
the vital signs, what the patient says about their symptoms, and their medical history. It's about seeing the big picture.
That's how you use CTS correctly and effectively.
Exactly.
It's recognizing that each patient is different, and what you see might not always match what you read in a textbook.
Sounds like a challenge, especially with all the pressure paramedics face in those intense situations.
Oh, it is. But it's a responsibility paramedics take seriously.
Yeah,
They understand the potential consequences if they get it wrong. They're trained to be as objective and unbiased as possible.
that's good to know. It reminds me that even with all the systems and protocols, it's highly skilled people making those decisions, using their training and experience to guide them.
Is what makes this system so successful.
Yeah.
Combining data-driven assessments with human expertise creates a dynamic approach to emergency care.
Like a perfect blend of science and art.
Exactly.
Speaking of seeing the big picture, I'm curious how CTES affects the whole emergency response system.
Okay.
We've talked about individual patients, but how does it impact things on a larger scale?
Great question.
Ooh.
CTES isn't just about individual patient care. It's about making sure the whole system runs smoothly.
Okay.
Remember that arrival CTS data we talked about?
Uh-huh.
It's not just used to make on-the-spot treatment decisions. It's also analyzed to look at response times, identify bottlenecks, and improve the overall efficiency of EMS.
Wow, I never thought of that.
Yeah, so it's not just about getting one person to the hospital. It's about making sure the whole system works as well as it can.
That's incredible.
And that data is then used to make decisions about things like where to position ambulances, getting hospitals ready, and even public awareness campaigns.
Hmm.
It's about always looking for ways to better respond to emergencies.
Like a giant feedback loop to help the system learn and grow. Okay, so as we finish our deep dive into CTES, I want to leave our listeners with a final thought. Imagine you're a paramedic called to a scene with multiple casualties, a big car accident, for example.
Okay.
You get there, and there are people everywhere with different injuries. How would understanding CTES help you navigate that chaos and make those life or death decisions?
That's a situation where CTAS is absolutely essential. It gives you a way to triage patients fast and efficiently, making sure the most critical ones get attention first.
Hmm.
It's about applying those levels of urgency to a complicated scene, making sure you use your resources effectively.
Like a mental map to guide you through the chaos, helping you make sense of an overwhelming situation.
Right. It also helps you communicate clearly with other responders in the hospital so everyone's on the same page.
Yeah, that level of coordination must be so important in those kinds of situations. So, to our listener, picture yourself in those shoes.
Yeah.
Think about how understanding CTAS could empower you to make a real difference.
It shows how the system goes from theory to practice, from the textbook to the street, and how it saves lives.
This has been an amazing deep dive. We've learned so much about CTES, how it works, why it's so important in emergency medicine, and how it affects individual patients and the whole system.
It's been great. It really is a fascinating system.
Yeah.
Hopefully this conversation has given everyone a new appreciation for how complex and challenging emergency medical care can be.
Absolutely. And to our listener, keep exploring, keep asking those questions, and stay curious about the world. Until next time.
Welcome to the Deep Dive. Today, we're going to take you behind the curtain of emergency medicine.
Oh, cool.
Yeah, to try to understand the Canadian Triage and Acuity Scale.
You might know it better as CTS.
That's right, CTSS. And the source for today's deep dive is the adultcts.pdf. It's a guide for paramedics.
Oh.
And we're going to unpack how paramedics use this system to assess patients rapidly and make life-saving decisions even in the most chaotic situations.
What's really interesting is that CTAS is basically a communication tool.
Oh.
It ensures a seamless transfer of information from paramedics to the emergency department staff.
So it's a secret language that helps everyone understand how urgent a patient's condition is right away.
Yeah, exactly.
So what exactly is CTS?
Well, think of it as a 5-level triage system used across Canada to prioritize patients based on how urgently they need care in the emergency department.
But it's not just about who gets there first, but who needs to be seen first.
Exactly. And level 1 resuscitation, that's reserved for the most critical cases. The ones that often require immediate life-saving interventions.
That's
like someone experiencing cardiac arrest or major trauma.
Okay, so those are the true lights and sirens situations.
Right.
What about the other levels?
So level 2 is emergent,
Okay.
and these patients need rapid assessment and treatment, but they aren't necessarily in immediate danger of dying.
Okay.
This might include someone having a stroke or a severe allergic reaction.
So still incredibly urgent,
Yeah,
but maybe there's a little more time to stabilize them before they're seen by a doctor.
precisely.
Gotcha. Okay, then what?
Then we have level 3, urgent.
Okay.
These patients need a timely assessment and treatment, but their condition isn't considered life-threatening at that moment.
Okay.
This could be someone with a broken bone or a severe infection.
So like you wouldn't want to wait around, but it's not an immediate rush to the operating room.
Right.
Okay, that's next.
Then there's level 4, less urgent,
Mm-hmm.
for patients who need to be seen that day but are stable. This could be someone with a urinary tract infection or a minor laceration that needs stitches.
Okay.
And finally, level 5 non-urgent is for those who could potentially be treated in a less acute setting,
Oh, right.
like a walk-in clinic.
Gotcha. So like minor ailments.
Exactly. Think of things like a sore throat or a small abrasion.
Okay.
And you might be surprised to learn that even something as seemingly minor as a small burn or a sprained ankle
Oh, really?
can have its own CTS level.
Wow.
It all comes down to those modifiers.
Okay.
For example, a small burn on a child or an elderly person could be more serious because their skin is more delicate.
I see. It can shift the whole picture.
Yeah.
It makes you realize how much thought goes into every CTS assessment.
Mhm.
So how do paramedics actually figure out which CTS level to assign?
It's a systematic approach involving up to 4 steps.
Okay.
The first step is the quick look. And this applies specifically to those critically ill patients where a CTS level 1 is evident immediately.
Oh, so if someone's not breathing or has a major bleed, it's pretty clear they're a CTS1.
Exactly.
That sounds like pure instinct and experience.
It is. It's like a sixth sense paramedics develop for recognizing those in extremis who need intervention now.
Wow.
But it's important to remember that the quick look is only for assigning CTS level 1.
Gotcha.
For all other cases, a more detailed assessment is needed.
Okay.
That's where the next steps come in.
So what's next?
Step 2 is presenting complaint.
Okay. Tell me more about that.
This involves determining the patient's chief concern,
Okay.
whether it's chest pain, difficulty breathing, or a sudden onset of weakness.
Mm-hmm.
This helps narrow down the possibilities and guides the paramedic towards potential CTS levels.
But it doesn't always give you the definitive answer, right?
You're absolutely right.
There's more to the puzzle.
There is.
Oh.
That's where first-order modifiers come in.
Right.
This is step 3, and it considers vital signs, level of consciousness, and pain level. All factors that can dramatically change the CTS score.
So it's not just about what the patient is telling you, but also what their body is saying.
Precisely. Imagine someone complaining of a fever. They might initially seem like a CTS 3, urgent.
Okay.
But if you add in low blood pressure and difficulty breathing, those modifiers bump them up to a CTS 1 resuscitation
Wow.
because they suggest a more serious, potentially life-threatening condition.
Oh, so each modifier adds another layer of complexity.
Yeah.
And then to further refine the assessment, there are second-order modifiers, which are even more specific to the patient's complaint.
Exactly. Let's say someone is experiencing chest pain. A second-order modifier might be whether the pain feels ripping or tearing, which could suggest a more serious issue like an aortic dissection.
Oh, wow. So even within a single presenting complaint, there can be nuances that affect the CTS level. Now, let's delve into some of these specific modifiers that paramedics use.
Okay.
I'm really curious to hear more about them.
One of the most crucial ones is respiratory distress. Paramedics use breathing rate, oxygen saturation, and visible effort to gauge the severity of a respiratory issue.
So if someone's barely breathing, that's a huge red flag.
Absolutely.
Yeah.
Another key modifier is hemodynamic stability, which focuses on how well the patient's circulatory system is functioning. Skin color, pulse, and blood pressure provide clues about potential shock or inadequate blood flow to the body's tissues.
That sounds like something that might not be immediately obvious.
You're absolutely right. This modifier is often overlooked, but it can be one of the most important in upgrading a CTS level.
Oh, wow.
It's all about recognizing those subtle signs of a failing circulatory system.
Okay, let's move on to level of consciousness. How do paramedics assess that?
They use the Glasgow Coma Scale, or GCS. It's a standardized way to measure a patient's responsiveness and alertness by assessing their eye-opening, verbal response, and motor response.
Okay.
Even subtle changes in GCS can be significant.
So a lower GCS score would indicate a more altered level of consciousness and therefore a more urgent situation.
Exactly. Now let's talk about temperature. You wouldn't think that would always be a major factor.
I guess we often associate fever with being sick, but I hadn't considered the role of temperature in a triage situation.
Both high fever and low body temperature can be red flags.
Oh,
High fever can indicate a serious infection,
right.
while low body temperature can be a sign of sepsis or hypothermia, both of which can be life-threatening.
So it's not just about whether someone feels hot or cold, it's about what those temperatures might be signaling.
Precisely. And this ties into a concept called SIRS,
Okay.
or Systemic Inflammatory Response Syndrome,
What's that?
which is basically the body's overreaction to an infection or injury.
Okay.
It's more than just a fever, it's a whole body inflammatory response that can quickly become dangerous.
That's a great example of how something that might seem simple on the surface can actually be quite complex.
Yeah.
Now, what about pain? I imagine that plays a big role in CTS assessments.
It absolutely does. Paramedics use a 0-10 pain scale and also consider the location and duration of the pain to determine how it might be impacting the patient's overall condition.
So a patient's pain level could actually influence their CTAS level.
Yes, especially when you consider that some types of pain are much more concerning than others.
Uh-huh.
For example, central pain originating from internal organs is generally considered more serious than peripheral pain, which comes from the skin or muscles.
Oh, okay. So if someone's having chest pain, that's automatically more concerning than a sprained ankle, even if the pain intensity is the same.
You got it. And another modifier that's important to mention is bleeding disorders.
Okay.
This applies to patients with pre-existing conditions or medications that affect their blood's ability to clot.
So even a seemingly minor injury could be more serious for someone with a bleeding disorder because they might not be able to stop the bleeding as easily.
Exactly. And finally, we have mechanism of injury, or MOI. This is all about understanding the forces involved in an accident,
Okay.
which can help paramedics anticipate potential internal injuries.
So even if someone seems okay after a major car accident, there could be hidden injuries that require urgent attention.
Precisely. Knowing the MOI can drastically change the CTS level. A high-speed car crash, for example, automatically triggers a CTAS too,
Oh, wow.
even if there are no visible injuries.
It sounds like paramedics are almost like detectives piecing together all of these clues to determine the best course of action. And they do it all under immense pressure.
Absolutely. They're incredibly skilled at assessing and prioritizing patients, even in the most chaotic situations. But CTAS isn't just about individual modifiers.
Right.
It's also about understanding how they all fit together to paint a complete picture of the patient's condition.
This is all so insightful. I'm starting to see those ambulances in a whole new light.
Yeah,
It's more than just lights and sirens. It's a complex system designed to save lives.
I agree. It's a field that requires incredible knowledge, quick thinking, and the ability to assess and prioritize patients under pressure.
Okay, we've covered a lot of ground here. What other crucial modifiers should we touch on before we move on to special considerations?
Well, there are a couple more key modifiers we should talk about.
Okay.
Blood glucose level. That's crucial for patients with diabetes.
Right.
Or anyone presenting with an altered mental status.
So even if someone seems confused or disoriented, it might just be a blood sugar issue.
Yeah, exactly. Hypoglycemia or low blood sugar can mimic a stroke
Oh, wow.
or other serious conditions, and it needs immediate treatment.
Gotcha.
Checking blood glucose is a quick and easy way to rule out a potentially life-threatening condition.
So it can really change the course of treatment.
It can dramatically.
Then there's hypertension, high blood pressure.
Mhm.
How does that factor into CTS?
Well, elevated blood pressure can be the primary problem,
Okay.
or a warning sign for other conditions like stroke or heart attack.
Mm.
It's often used to modify or upgrade the CTS level based on the severity of the hypertension
I see.
and the presence of other symptoms.
So high blood pressure isn't always an emergency,
Right.
but it can certainly be a red flag depending on the context.
Exactly.
What about dehydration? I imagine that's pretty common.
Oh, it is. It's particularly dangerous in the elderly and young children,
Yeah.
as they're more susceptible to its effects.
Right.
The severity of dehydration is assessed based on signs like dry mucous membranes,
Okay.
tachycardia, and decreased skin turgor.
Dehydration can really sneak up on you,
It can.
especially in hot weather or if you've been sick. It's another example of a modifier that might not seem immediately critical, but can have serious consequences if left untreated.
Absolutely.
Yeah.
Now, let's shift gears a bit
Okay.
and talk about some special considerations that come into play when assigning CTS levels.
All right, so what are some of those unique situations?
Well, pregnancy, for one.
Oh, right.
Expectant mothers have their own set of modifiers to account for potential complications that are specific to pregnancy.
That makes sense. Pregnancy can bring a whole host of new challenges,
It does.
both for the mother and the baby.
Exactly. And some conditions, like a prolapsed umbilical cord or heavy bleeding in the third trimester,
Oh, wow.
they require immediate intervention.
So time is of the essence.
Absolutely.
So how does CTAS help paramedics prioritize pregnant patients?
There's a specific set of modifiers that address pregnancy-related complications.
Okay.
For example, a woman experiencing heavy vaginal bleeding in her third trimester.
Right.
She would automatically be considered a CTS1 resuscitation
Wow.
because that could signal a life-threatening situation for both her and the baby.
So those pregnancy-specific modifiers can really bump up the urgency level.
It can.
It's fascinating how CTS takes into account such a wide range of factors.
It really does. They're designed to ensure that both mother and baby receive the most appropriate care as quickly as possible.
That's amazing. Now let's talk about another special consideration, mental health emergencies.
Okay.
Those can be really tricky to assess
They can.
because there aren't always clear-cut physical signs like a high fever or low blood pressure.
You're right. It's not always as straightforward as taking someone's temperature or checking their pulse.
So how do paramedics approach CTS in these situations?
Well, if there aren't those obvious physical signs,
Right.
it becomes more about evaluating the patient's behavior
Okay.
and their potential for harming themselves or others.
So it's about assessing the risk of harm.
Exactly. The CTS guidelines for mental health focus on determining the severity of the crisis
Okay.
and the potential for dangerous behavior.
Gotcha.
It's about assessing the risk of harm to the patient or others.
Can you give me an example of how that might play out in a real-life scenario?
Sure. Someone experiencing suicidal thoughts without a specific plan,
Yeah.
they might be a CTS3, urgent.
Okay.
But someone who has already attempted suicide or has a detailed plan,
Right.
they would be considered a CTS2 emergent
Oh, okay.
because the risk of immediate harm is much higher.
So it's all about gauging the level of risk and the immediacy of the threat.
Yeah.
That sounds like a lot of pressure for paramedics.
It is. They have to make difficult judgments based on limited information,
Yeah.
often in chaotic environments. It takes a lot of skill and compassion to navigate mental health emergencies effectively.
Absolutely. We've talked a lot about the guidelines and modifiers, but what about those cases that don't fit neatly into the CTS framework?
You're right. Not every patient presentation is textbook.
So what happens in those situations? Do paramedics just have to rely on their gut feeling?
Well, it's not just about following a rigid set of rules.
Okay.
While the CTS guidelines provide a solid framework,
Right.
there's also a crucial element of experience and instinct that comes into play.
So it's a blend of science and art,
Yeah, you could say that.
using both objective data and subjective judgment.
Exactly. Experienced paramedics have seen a wide variety of cases,
Yeah.
and they've developed a sense for when something just doesn't feel right.
Uh-huh.
Even if the patient's vital signs and presenting complaints seem relatively benign.
So they're trained to trust their gut feeling.
In a way, yes. But it's not just a random hunch. It's an informed intuition based on years of experience and a deep understanding of human physiology and pathophysiology.
That's reassuring to know that even in those ambiguous situations, patients are still in good hands.
Yeah.
Now, what about situations where a patient's CTS level might change? A person's condition can evolve rapidly, right?
So that's a great question. And yes, absolutely. A patient's condition can change quickly,
Yeah.
and their CTS level can be adjusted accordingly.
Can you give me an example of how that might happen?
Sure. Let's say a patient initially presents with mild shortness of breath
Okay.
and is assigned a CTS3 urgent,
Right.
but during transport, their breathing deteriorates.
Oh, no.
And their oxygen saturation drops significantly. In that case, the paramedic would upgrade their CTS level to a 2 emergent
I see.
to reflect the worsening of their condition.
So it's a dynamic system that allows for flexibility and responsiveness to changes in a patient's status.
Exactly. And this highlights the importance of ongoing assessment and reassessment throughout the patient encounter. Paramedics are constantly monitoring for any signs of deterioration or improvement.
This whole conversation is really making me appreciate how much goes into those seemingly simple decisions about who gets seen first in the emergency department.
It's truly a complex system, and it all boils down to ensuring that patients receive the right care at the right time.
Okay.
Speaking of the right care, we've talked a lot about how CTAS determines the urgency of a patient's condition.
Right.
But how does that actually translate into action once the ambulance arrives at the hospital?
That's a great question.
Right.
It's one thing to assess and categorize a patient's condition, but how does that information actually guide their experience once they reach the hospital?
The CTS level assigned by the paramedics directly influences how quickly a patient is seen by a physician in the emergency department.
Okay.
Think of it as an air traffic control system for the ED.
Oh, I like that.
It's guiding patients to the right runway based on the urgency of their landing.
So a CTAS 1 patient would bypass the waiting room and be taken straight to a treatment area.
Exactly. For CTAS 1 patients, every second counts.
Right.
They need immediate life-saving interventions. The ED staff is prepared to receive these patients and initiate treatment the moment they arrive.
And what about the other CTAS levels? Are there specific wait times associated with each category?
Yes, there are target times for each level.
Okay.
CTAS 2 patients should be seen by a physician within 15 minutes of arrival.
Wow.
CTAS 3 patients within 30 minutes, and so on.
So the higher the CTS level, the shorter the wait time.
Precisely. The CTAS system helps create a streamlined flow in the ED,
Yeah.
ensuring that patients are seen in a timely manner based on the urgency of their condition.
It's like a well-choreographed dance with everyone working together to provide the most efficient and effective care possible. I'm curious about how CTAS impacts the overall flow of the emergency department.
Okay.
It's not just about individual patients, right?
That's an excellent point. The CTAS system is also about managing the overall capacity and flow of the emergency department.
Okay.
It helps the ED staff prioritize patients and allocate resources effectively, even when they're completely overwhelmed.
Can you elaborate on that? I'm imagining a busy Friday night in the ED.
Oh, yeah.
Ambulances are arriving one after another, and the waiting room is packed. How does CTS help manage that chaos?
By having a clear understanding of the acuity of each patient arriving, thanks to the CTS level assigned by the paramedics,
Right.
the ED staff can anticipate needs, prepare treatment areas, and allocate staff accordingly.
So it's like a triage system on a larger scale, helping to orchestrate the entire flow of the emergency department.
Exactly. And this is crucial for ensuring that all patients, regardless of their CTS level, receive timely and appropriate care.
That makes sense. Now let's talk a bit more about how paramedics use their judgment and experience to make these CTS assessments.
Yeah.
It's not always a simple calculation. We've talked about the guidelines and the modifiers, but there's also that human element that plays a vital role in the decision-making process.
Exactly. It's not just about plugging numbers into a formula.
Right.
Paramedics are trained to recognize subtle cues,
Yeah.
to read between the lines, and to trust their instincts.
It's that combination of knowledge, experience, and intuition that makes them so effective in these high-pressure situations.
Yeah.
Yeah, it's incredible how they can process all that information so quickly to make these really important decisions. Now, we've talked a lot about the general framework of CTI, but I want to see it in action.
Okay.
Can we walk through some scenarios to see how it plays out in real life?
Absolutely. Let's start with something relatable, like a sprained ankle.
Okay.
Might seem pretty straightforward, but even then, paramedics have to consider all these important modifiers.
So it's not as simple as assuming a sprained ankle always equals a CTI's 4 or 5, less urgent or non-urgent.
Not necessarily. Remember, it's all about the whole picture. Let's say a young, healthy athlete twists their ankle playing basketball. They're in a lot of pain, but their vital signs are stable and there's no obvious deformity.
Okay, yeah, in that case, I could see it being a CTAS for less urgent. They
Right.
need to be seen, but it's not like an immediate rush.
Yeah, that's a good initial assessment.
Okay.
But now imagine that same injury happening to an elderly person with a history of blood clots.
Ah, that changes things.
Right.
Now we got to think about the bleeding disorders modifier.
Exactly. Because of that bleeding disorder, even a seemingly minor injury like a sprained ankle
Yeah.
could be a much greater risk.
Wow.
That could bump their CTS level up to a 3 urgent
Oh, okay.
to make sure they're evaluated quickly for potential complications.
That's a great example. It shows how important those individual patient factors are.
Yeah.
Okay, let's try a more complex scenario.
Okay.
What about someone experiencing chest pain?
Okay.
That can range from something minor to a life-threatening condition.
You're right. Chest pain is one of those presentations that always sets off alarm bells for paramedics.
Oh, yeah, for sure.
It's their job to figure out quickly if it's something like heartburn or a heart attack.
How do they even begin to tell those apart in those first few minutes?
Well, it starts with gathering as much information as possible.
Okay.
They'll ask about the nature of the pain. What does it feel like? Where is it located? Does it radiate to other areas?
Right.
They'll also ask about any other symptoms like
Um,
shortness of breath, sweating, nausea, or dizziness.
so they're putting together the pieces looking for clues?
Exactly.
Yeah.
They'll also think about the patient's medical history.
Okay.
Do they have any risk factors for heart disease? Have they experienced similar pain before?
Mhm.
And of course, vital signs are crucial.
So like an elevated heart rate or irregular pulse or low blood pressure?
Exactly. Those are all red flags.
Okay.
Let's say a patient describes their pain as a pressure or squeezing sensation that
Yeah.
radiates to their arm and is accompanied by shortness of breath and sweating.
Those are all classic heart attack symptoms.
They are. And if those symptoms are paired with any abnormal vital signs,
Yeah.
it would likely trigger a CTAS-2 emergent.
Okay.
In those cases, time is critical to get them definitive care.
And what if the patient's pain is more like a burning sensation and it's relieved by antacids?
That sounds more like heartburn or indigestion.
Yeah.
If their vital signs are stable and there are no other concerning symptoms,
Right.
they might be assigned a CTES for less urgent.
So they need to be seen, but it's not an emergency.
Exactly.
It's amazing how, even with something common like chest pain, the CTAS system helps paramedics make these important distinctions between a less serious condition and a potentially life-threatening emergency.
It really is. It's about recognizing patterns, considering individual patient factors,
Yeah.
and using all that information to guide their decisions.
This conversation has been so eye-opening. I have a
Right.
whole new appreciation for what paramedics do.
I'm glad to hear that. It's a field that often goes unnoticed, but the work they do is truly remarkable.
This deep dive has been incredibly insightful.
Good.
I feel like I have a much better understanding of the Canadian triage and acuity scale
Yeah.
and how vital it is in emergency medical care.
It's all about making sure patients get the right care at the right time.
Absolutely. Thank you so much for joining us on the deep dive.
It was my pleasure.
We hope you'll join us next time as we explore another fascinating topic.
Okay, so picture this. You're a parent and your child is sick or hurt really sick or hurt like 9/11 kind of sick or hurt.
It's a parent's worst nightmare, right?
Absolutely. And when those first responders arrive, the paramedics, it can feel like everything's moving a mile a minute.
Definitely a lot of pressure.
Yeah, so today's deep dive is all about helping you guys understand the system paramedics use to figure out how urgent a kid's medical situation is.
Exactly. It's called the Pediatric CTAS, the Canadian Triage and Acuity Scale.
And we're going to break it down step by step using the actual guide that paramedics use.
So consider this your backstage pass to understanding how these decisions are made.
And hopefully it'll give you a little peace of mind if you're ever in that scary situation.
Knowledge is power, right?
Exactly. So let's say the ambulance pulls up sirens blaring. What's the first thing they do?
Well, it's not like what you see on TV with adults where it's all check the airway breathing circulation.
Yeah.
With kids, it's all about the Pediatric Assessment Triangle or PANTEC.
Okay, so what's that all about?
Think of it as a quick but super important first look. They're checking the child's appearance, their breathing, and their circulation.
3 things they can see right off the bat.
Exactly.
So appearance, does that mean like, are they wearing a cute outfit?
Haha. No style points here. They're looking at how alert the child is, how they're interacting, if there are any obvious signs of distress.
Like, are they responsive or are they just totally out of it?
Exactly. Or are they somewhere in between? Like, are they
Good.
anxious? Are they agitated? All those things give clues.
Makes sense. Okay, what about breathing? Is it just how fast or slow they're breathing?
It's more than just the rate.
Yeah.
It's also the effort. Like, are they struggling to breathe? Is their chest pulling in with each breath? Are their nostrils flaring?
So they're looking for those visual cues.
Exactly. And they're also listening for any abnormal breath sounds, like wheezing or stridor.
Stridor.
Yeah, it's a high-pitched sound that can mean their airway is partially blocked.
Oh, wow. So that's serious.
Very serious.
Yeah,
It often means they need help breathing right away.
got it. And what about circulation?
That's all about checking their skin.
Okay, so like what are they looking for?
Things like color and temperature. Are they pale, flushed? Are they clammy or dry?
So basically, are they showing signs of dehydration or shock?
Exactly.
This parate thing seems pretty important, like a first impression that guides everything else.
It is. It really helps paramedics decide what to do next and how quickly they need to act.
So it's the foundation of the whole CTS system.
You got it. Now, the guide also talks about common reasons people call 911 for a child.
Like what?
Well, the most common are fever, trouble, breathing injuries, acting strange, and vomiting or diarrhea.
Pretty much covers all the bases.
Yeah. And the thing is, these things can present so differently in kids than adults.
Right. A fever in a baby is way scarier than a fever in an adult.
Exactly. So paramedics need specific training to know what they're really seeing.
Okay, but how do they even figure out what's going on when little kids can't exactly give a detailed medical history?
Good point. That's where talking to the parents or caregivers becomes crucial.
But even that can be tough. Like, imagine trying to explain why your toddler is screaming while someone's trying to check their pulse.
It's chaotic for sure.
Mm.
So how do they cut through all that and get reliable info? Well, the guide emphasizes the importance of asking the right questions.
Like, what kind of questions?
They avoid leading questions, the kind that might influence how the caregiver answers.
Right, right.
And they use a mix of open-ended questions like, what happened? And more specific ones like, did they hit their head?
So they're trying to get a clear picture from all angles.
Exactly. It's like detective work.
I like that medical detectives.
And the guide even mentions paying attention to nonverbal cues.
Oh, interesting. So not just what the kid is saying, but how they're acting.
Exactly. And not just the kid, but the parent, too.
The parent, what do you mean?
Well, think about it. Parents know their kids better than anyone.
True.
So the guide says that a parent's perception of how sick their child is can actually influence the CTAS level.
Wow, so they're not just brushing off a parent's gut feeling.
Not at all. They're taking it seriously.
That's really interesting. So they're acknowledging that parents often just know when something's seriously wrong.
Exactly. It highlights that parent-child bond and how powerful a parent's intuition can be.
Okay, but what happens if the first look and the initial assessment don't give them a clear answer?
That's where the modifiers come in.
Modifiers, it sounds complicated.
Think of them as extra clues that help fine-tune the urgency level, and they're applied in a specific order.
Okay, so let's break down these layers. What are first-order modifiers, and how are they different for kids?
First, you have the physiological modifiers.
Yeah.
Basically, the child's vital signs.
So heart rate, breathing,
Yeah.
blood pressure, all that.
Exactly. But here's the thing about kids. What's normal for a toddler is totally different for a teenager.
Right. A racing heart in a toddler who's been running around is no big deal. But in a teenager, that could be a red flag.
Exactly. So paramedics use age-specific charts to interpret those readings.
Okay, that makes sense. So those vital signs, along with everything else they've observed, help determine if something's off. What about the non-physiological first-order modifiers?
Those come into play if the vital signs and initial assessment haven't given a clear picture. We're talking about pain and the mechanism of injury.
Pain seems pretty straightforward. But how do they figure out how much pain a child is in, especially if they're too young to explain it? My toddler cries if I don't cut a sandwich right.
It's definitely tricky. The guide talks about this a lot. They rely on what the child or caregiver tells them and any physical signs they're showing, like crying, guarding, or acting differently. And unlike with adults, they don't get hung up on whether the pain is central or peripheral. It's all just pain to a kid who can't exactly pinpoint where it hurts.
Right, and then there's the mechanism of injury. So basically figuring out how the injury happened.
Exactly. Was it a fall from a tree?
Yeah.
A car accident? The guide has specific criteria for different situations because a kid who fell off a bike is probably going to be treated differently than one who was ejected from a car.
So they're really trying to piece together all the clues.
Exactly. It's all about understanding the bigger picture.
Yeah.
But we haven't even touched on those second-order modifiers yet.
Okay, so let's unpack those in part 2 of our deep dive.
Right, so second-order modifiers, they come into play when things aren't totally clear-cut.
Like, what kind of situations are we talking about?
One big one is blood sugar.
Okay, so why is that such a big deal in kids? Isn't low blood sugar just, feeling hangry?
For adults, maybe, but for little ones, especially babies, it's way more serious.
Really?
Oh, yeah. Kids don't have a lot of stored energy, so low blood sugar hypoglycemia can be really dangerous.
Like, how dangerous are we talking?
We're talking seizures, brain damage, even death if it's not caught quickly.
Wow, I had no idea it was that serious.
It's one of those things paramedics are always watching out for, especially in young kids.
That makes sense. So what other pediatric-specific modifiers are there?
The guide lists a bunch. Stridor, which we talked about before.
That high-pitched breathing sound.
Exactly.
Yeah.
Then there are spells where a baby stops breathing.
Apnea.
Yeah, exactly. Also, inconsolable, crying a baby who seems floppy, or limp trouble walking, or even if a child has a known congenital disorder.
Wow, it's amazing how much they have to consider.
It's a lot to juggle for sure.
Okay, so we've talked about the PAT, common complaints communication, all these modifiers, but how does this all fit into those CTS levels?
Right, so just a reminder for our listeners, the CTS levels range from level 1 resuscitation, the most urgent, down to level 5, non-urgent.
And it's all about how quickly a child needs to be seen and what kind of care they need.
Exactly. So let's start with level 1 resuscitation. These are the true life or death situations.
So if a child isn't breathing, that's an automatic level 1.
Absolutely. No breathing, cardiac arrest, major bleeding. Those are all level 1 situations where every second counts.
So paramedics are going to start life-saving measures right there on the spot.
You got it.
Yeah.
And they'll get the child to the hospital as fast as humanly possible.
What about something like a burn? How bad does a burn have to be a level 1?
The guide says a burn covering 25% or more of a child's body is a level 1. And those often need to go straight to a special burn center.
25%?
Huh?
Wow, that's a lot. What about less severe burns?
Even those are taken very seriously. A burn covering 10% of a child's body, or burns on the face, hands, or feet, those are considered level 3 urgent.
So burns are always a big deal no matter what.
Absolutely. They can
Right.
be really serious, especially in kids.
Okay, let's move on to level 2 emergent. What's an example of that?
Well, remember stridor, that high-pitched breathing sound.
Yeah.
That's often a level 2 because it can mean the airway is partially blocked, and that can quickly become a complete blockage.
Oh, wow. So it's like a warning sign that things could get worse fast.
Exactly. So they need to get to the hospital pretty quickly.
Makes sense. Okay, what about level 3 urgent? What kind of situations fall into that category?
The guide lists a lot of things. If a child is vomiting bile, possible appendicitis, or even a baby who's inconsolable and has abnormal vital signs.
Wait, so a baby crying a lot can be a level 3.
It can, especially in babies inconsolable. Crying, especially if their heart rate or breathing is off, can mean something is seriously wrong.
So it's not just a typical fussy baby.
Exactly. It's something that needs to be checked out.
That's good to know.
Do you have any-
What about level 4 less urgent? What's an example of that?
Let's say a child has a possible broken bone, but their circulation and nerves seem fine.
So it's still an emergency, but not a life or death situation.
Right. It still needs to be taken care of, but they don't need to rush to the hospital with lights and sirens.
And then we have level 5, non-urgent.
Yeah, those are things like sore throats, stuffy noses, minor cuts and scrapes, things that might need a doctor's visit but aren't true emergencies.
So it's helpful to see those different levels laid out like that.
Yeah.
It makes the whole system a lot clearer.
Definitely. And it highlights how paramedics use all this information, the PAT, the modifiers, the presenting complaint, to determine how urgent the situation is.
So they've assessed the child, used all these tools, and figured out the CTS level. What happens next? What does that level actually mean for the child and the parents?
That's the big question, and that's what we'll explore in part 3.
Okay, so we've decoded the pediatric assessment triangle. We've talked about those modifiers, and we've explored the different CTS levels. But the big question is, what happens once the paramedics have figured all that out?
Right. It's not just about how fast they drive to the hospital.
Right. So what does the CTS level actually determine?
It guides everything about how they transport the child and the kind of care they get at the hospital.
So let's break it down. Starting with level 1 resuscitation, we know that's the most urgent, so what happens then?
Level 1 is all about immediate action. Lights and sirens full speed ahead. They'll start life-saving interventions right there on scene. CPR, stopping bleeding, whatever they need to do.
And are they always heading to the closest hospital?
Not necessarily. They might go to a hospital that's further away, but better equipped to handle those really serious cases. Like a trauma center or a specialized pediatric hospital.
So it's about getting the child to the right place as quickly as possible.
Exactly. What about level 2 emergent? Is it the same, just a little less urgent?
Yeah, is it still a mad dash to the hospital?
Level 2 is still a rush, but there might be a bit more time for assessment and stabilization before they hit the road.
Okay, so they might spend a few extra minutes on scene.
Right. Making sure the child is stable as possible before they transport them. And they'll probably still use lights and sirens, but it might not be quite as frantic.
Got it. So level 1 and 2 are pretty straightforward. Get to the hospital fast. What about level 3, urgent?
Level 3 is still urgent, but it's more about getting to the hospital quickly and safely.
So no need to break any speed limits.
Right. They'll probably skip the sirens and focus on a thorough assessment on scene. Maybe start an IV, give pain medication, things like that.
So the key here is that the child's condition is serious, but not immediately life-threatening.
Exactly.
What about level 4? Less urgent. How does that play out?
Level 4 is where the paramedic's judgment really comes into play. They'll consider the child's condition, what the parent is saying, and the resources available.
So there's more flexibility at that level.
Definitely. They might take the child to a hospital, but maybe not the ER.
Oh, interesting.
Yeah. Or they might recommend going to a primary care clinic instead. And in some cases, they might even advise staying home and monitoring the child closely.
Really? So they wouldn't automatically take the child to the hospital?
Not always. It depends on the situation. But they'd give the parents clear instructions on when to call back if things change.
That's really interesting how much discretion they have at that level. It really highlights the importance of their expertise.
Absolutely.
Yeah.
And then, of course, we have level 5, non-urgent.
Right. So what happens in those situations?
Level 5 is usually about providing reassurance and advice.
Mm-hmm.
Maybe a little basic first aid. Transport to a hospital isn't usually necessary, but they might suggest seeing a doctor for follow-up.
So basically it's like, okay, everything seems fine here, but you might want to get this checked out just in case.
Exactly. It's about peace of mind.
It's fascinating how this whole CTS system guides every step of the process, from the moment the ambulance arrives to where the child ends up getting care.
It's a really comprehensive system. And it's all about making sure children get the right level of care based on how sick or injured they are.
This has been such a great deep dive. I feel like I have a much better understanding of what to expect if I ever have to call 911 for my child.
Me too. It definitely takes some of the mystery and anxiety out of this situation.
And it's empowering to know how the system works and what questions to ask.
Absolutely. And I think it's worth repeating that a parent's intuition is a powerful thing. You're your child's best. So if your gut is telling you something's wrong, even if the paramedics don't seem too worried, don't be afraid to speak up. Advocate for your child. Ask questions. Share your concerns.
That's such an important reminder. Sometimes you just have to trust your instincts.
Exactly. So as we wrap up this deep dive, I hope everyone listening feels a little more prepared and a little less scared about facing a medical emergency with their child.
Absolutely. Knowledge is power. And now our listeners have the power to understand the system and be the best advocates for their kids.
Thanks for joining us on this deep dive into the pediatric CTAS. It's been a pleasure.
It really has. Thanks for listening, everyone. And